My name is Dr. Todd Lepine, and I'd like to introduce you today to functional medicine. For those of you who aren't familiar with functional medicine, it's a new paradigm in which physicians can look at patients from multiple dimensions to see what's going on in the body that's causing lack of function. It's not uncommon for patients to come to me with a variety of different complaints: fatigue, chronic malaise, joint aches, brain fog, just a lot of unexplained, ill-defined symptoms. And very often patients have had a number of diagnostic tests done, including laboratory tests and x-rays, and everything looks fine. All the structure may be fine, but the function's not fine. And I like to make the analogy that a common thing that I will see is someone will come to me with some type of gastrointestinal problem, with a bloating, gas, constipation, heartburn type symptoms. And they've often had endoscopies from above and endoscopies from below, and the doctor says everything's fine. Well, that's a little bit like having a room inspector come into a room and look at all four walls and say, well, the room looks good, and then when you go to flip the light switch doesn't work. You go to turn on the water doesn't work, and you go to plug in to an outlet, and the outlet doesn't work. So the structure may be fine, but the function's not fine. And functional medicine is looking at unseen forces within the body, looking at both nutrition, metabolism, biochemistry, how the body detoxifies, to really see what may be going on that is missed by mainstream medicine. And oftentimes advanced testing is required for this, and that's really where Metametrix shines. Metametrix has tests which look at organic acids, tests that look at fatty acids, tests that look at how your body detoxifies, markers for neurotransmitter metabolites, and a variety of other ways in which you can look inside the body at unseen forces that may be pushing a person towards ill health. One of the new tools that I have that I'd like to show you today is a book that Metametrix has come out called Laboratory Evaluations in Functional Medicine. And I consider this really a map for those who want to practice functional medicine. It really helps to guide you and helps you to relearn some of the biochemistry that you may have forgotten when you were in medical school, and takes you through the body on both the physiological level, the nutritional level, the metabolic level, so that you can find things that would be normally missed by mainstream medicine testing. And it's, again, to make an analogy, it's very common for me to see someone and they've had a whole battery of laboratory tests done by major lab test companies like Quest Diagnostics, LabCorp, and all the tests look normal, but the patient doesn't feel well. And that's a little bit like if you're walking down a street and you drop your quarter on the left side of the street and you're shining your light on the right side of the street, you're never going to find the quarter. The kind of testing that looks within the body at function and metabolism, organic acids, fatty acids, is really available today. And for those who don't know about it, Metametrix offers these types of tests, and they really can help you to make a better diagnostic decision as far as what's really going on with the patient, so that you can really regain some joy in how you are dealing with these patients who have chronic illnesses that you're quite frustrated with. And it's very common today. I always like to joke that, I tell patients my goal in treating them is to avoid them seeing surgeons and to have them on the least amount of medications. Not that surgeons don't have their role, or not that medications don't have their role, but the body really has an innate ability to heal itself. And when you do advanced functional medicine testing, you can look within to find out what's out of balance, what may be missing, what may be in excess, and what the body may be fighting against in terms of inflammation or bad fatty acids or infections. And these kinds of tools really make it a lot more fun to practice medicine, and it really facilitates getting patients well without some of the toxic side effects of certain medications. And it allows us to really get to the root causes of what's going on within a person's nutritional biochemistry. So I look forward to working with all of you and coming to these various talks that we'll be doing in the future, and helping you to regain health for your patients, both of mind and body. Thank you.